Good evening from Rocky Mountain PBS. I'm Cynthia Hessin. This is Colorado State of Mind. On our minds tonight, a couple of healthcare stories. And just a bit later, we will tell you about the Denver Research Institute, which has found a very interesting connection between Down syndrome and Alzheimer's disease. But we begin tonight with one of the ongoing quests of the Obamacare era, and that is access to medical attention for everyone without socially triggered barriers or barriers of where people live, learn, work, and play. Dr. Adewale Troutman has come for a visit to Denver from the University of South Florida, and many Colorado health advocates heard him speak at a recent luncheon put on by the Colorado Trust. Dr. Troutman has spent 40 years focused on public health medicine and practice, including his current teaching in Florida and his current position as president of the American Public Health Association. It is great to have some time with you here, Dr. Troutman. Health equity obviously is not easily achieved, but you founded the first Center for Health Equity with a local health department, and that was how long ago?
Oh, it's been about 5 or 6 years now. The effort was to recognize that we needed a new approach to addressing the issues of differences in life expectancy and health status and access to care and access to education and housing and living wage, etc. We needed a new way to look at that rather than what we had been doing as a society, because it hasn't worked. The differences in health status for our population have been in existence for over a century minimally. In some instances, more like 2 or 3 centuries. And we've tried the medical model, we've tried the individual approach, we've tried to tell people just eat more fruits and vegetables and drink more water and exercise, and we'll close the gap. But it hasn't worked. The gap is, as a matter of fact, increasing. So the focus on health equity is trying to shift the direction to focus on things that are not, we don't traditionally think of as health related, but they are dramatically important in the health of populations, like transportation, housing, zip code. Just recently, there was a story on NBC not too long ago that said that research has found that where you live plays an important role in your health. So when you start looking at some of those factors, you have to find a way to broaden the work that you do and how and where you do that.
So at this center, then, you have people who are helping people with all those things, trying to improve whatever transportation they have to get to and from a clinic and so forth?
Well, the idea is to work on the system itself. So that as a health department, we reach out to others who are more directly responsible for things like transportation and housing and bring them into the loop. So we sit down to the ideal situation. We sit down together, look at housing, education, transportation, access to care. How does that impact the populations that we're working with? And what do we do to increase access? So we need to improve transportation, to improve the educational system, to decrease the percentage of dropouts, because dropouts means not only losing educational attainment, but shortening your life expectancy. So it's not that the staff goes out and does all these things themselves, because we don't control, as a sector, we don't control everything that's out there. I would like us to be able to do that. I think we might be able to get some more progress. But it's about changing the relationships and changing the interactions so that the transportation folk, when they think about transportation, they think about what's the health impact of us cutting off this route, for instance? Or what's the health impact of taking money out of education and kids not being able to go to school because they can't afford whatever the issues are?
That is a very interesting, holistic type of approach. How are you going to measure the impact?
That's a challenge. We know that. How to evaluate these relationships and outcomes is a challenge. We think that there are opportunities to measure certain things, like several indices that have been developed in Connecticut around employability, nature of housing in a particular area, graduation rates. So they're kind of proxies for health status, but they all relate to health status. And finding the exact mechanism, the exact evaluation strategies is still not up in the air, but it's still an issue that we're all struggling with. Matter of fact, there were some questions around that at the workshop that we did. How do we measure our success? Ultimately, the ultimate measure of success would be there'd be no gap between life expectancy and health status based upon race, socioeconomic status, ethnicity, language, sexual orientation, disability status. These are all the things that are inequities in the system right now. So the ultimate would be that there were no differences.
There is a report that our iNews team did recently called Losing Ground, in which I was so startled to see how many more African American babies die in the first year.
Yeah, that's one of those really dramatic and important inequities that we talk about. Infant mortality globally is seen as probably the major indicator of the nature of a society, not only the health status, but how that society is organized and what its priorities are. And for years, we've noticed that African Americans have probably 2 to 3 times the rate of infant mortality when you compare black babies to white babies. Latinos are not doing too well either. They're not quite as bad as the African American population, but their rates are probably 1.5 to 2 times greater than the white community. And for decades, we've been struggling trying to find out why that's the case and what we do about that. Is it early prenatal care? Is it the relationship between poverty and practice? Is it access to medical care? Is it access to care for the life of the woman? There's a new strategy called life course events, which is looking at not only the birth period, the pregnancy, the prenatal care, the postnatal care, and the delivery, but the total the life course of that woman. And what are we doing about women's health that improves the likelihood they're going to have babies that are going to be born at the right size and the right time. In addition to that, we found that even professional women, there's some studies done around African American women who are professional, still have low birth weight babies in spite of doing everything right.
That is
and
very
there's an
curious.
expectation, there's a relationship between discrimination, lifelong discrimination, chronic stress from lifelong discrimination that elevates cortisol levels. That's a hormone in the body that subsequently causes a low birth weight baby. So there's a lot of factors going on here, but it indicates that the approach has to be a multidisciplinary approach.
Is it the type of thing that what you're doing at this center in Kentucky, it can be replicated in other areas of the country?
We just came back from Kalamazoo, Michigan, where they were so impressed with what we did in Louisville. They have started the Center for Health Equity. We just did their first Health Equity Summit a couple of weeks ago. So yes, there are those in Milwaukee. There are others who replicated what we did in Louisville to take that model to their local municipalities to try to replicate some of the work that we've been doing.
And so it's basically a matter of trying to get more people to look at everything through the lens of health. Through the
lens of health and health equity. Not because health in even of itself is defined by the World Health Organization as the presence of physical, psychological, social, and economic well-being, not merely the absence of disease or infirmity. So that very notion of how we address health is one that's much broader than we traditionally have looked at in Western medicine.
I want to just end with a couple of things about you, because you have such an interesting background, born and grew up in the Bronx. And then why did you tell me that you decided to go to medical school?
I've been, for my entire life as a young kid and then growing up to an adult, it's been about how do I make a difference. I became aware of the issues around civil rights, human rights, historical abuses to the African American community, and have made a decision early in life that I was going to make a difference. So I thought, there are lots of things I tried, and I finally came to the realization that the one thing that's going to make the biggest difference is my being in medicine, and public health in particular. And I think public health has the opportunity to change the millions and millions of lives by a single policy that you developed as a result of the work and the focus on improving the health of populations and closing the gap so that we look at this as a matter of human rights and social justice.
Thank you so much, Dr. Troutman, for your insights tonight. And now we're going to turn to a new topic. The Global Down Syndrome Foundation, which is located here in Denver, funds research in several areas of the world where specialists are studying the cells and genes and abnormalities of Down syndrome. Our next guest will tell us about an unexpected discovery.
Well, the most important aspect of the link is that everyone who has Down syndrome will develop the pathology in the brain of Alzheimer's disease starting in their 20s and becoming full-blown by their 40s. And about half of them will develop Alzheimer's dementia by the time they're 60. So the diseases are intimately linked in that way.
Geneticist Huntington Potter, who discovered the link, has come to Colorado to be director of Alzheimer's programs for the University of Colorado and the Linda Crnic Institute for Down Syndrome. Parents of children with Down syndrome say it will be a big boost for them and for fundraising.
I'm really, really passionate about research into Alzheimer's because our child is amazing. He happens to have Down syndrome. but everything that he knows now and his intelligence, I don't want that to be compromised by an early onset of Alzheimer's.
I feel much more secure that there will be answers now with Huntington Potter and because of the Linda Crnic Institute.
Joining us now is Dr. Huntington Potter, Director of Alzheimer's Programs at the University of Colorado Anschutz campus and Director of the Alzheimer Program at the Crnic Institute. He is with us, and also Michelle Livingston from the Global Down Syndrome Foundation. Doctor, let's start with this connection between these two diseases. I presume this means you will have more area to open up and see, determine treatment and causes and so forth of the two diseases.
That's exactly correct. For about 30 years, we've known that people with Alzheimer's disease actually are related to people with Down syndrome because people with Down syndrome develop Alzheimer's disease in the brain by their 20s and 30s, and they usually develop dementia by 50 or 60.
Half of them, did you say, Mike?
Half of them develop dementia by 50 or 60, and all of them develop Alzheimer's pathology in the brain.
Oh, my goodness.
So that means these two diseases are really, in the brain, the same problem, and what we're now looking at is how we can use that to develop better treatments for Alzheimer's disease in the typical aged population and in people with Down syndrome.
Michelle, this is something that the Global Down Syndrome Foundation has dedicated itself to. Before we started, we were remarking on how there's really a lot less money spent on research in this area than there is in a lot of other medical areas.
Yes, that's right. And actually, Down syndrome is one of the least funded genetic conditions, both in the private sector and by the National Institutes of Health, but we're working really hard to change that, and we're working hand in glove with the National Institutes of Health to get that funding up and bringing on some really amazing researchers and scientists who will really dedicate their time and efforts to this research.
And you are about to launch a registry. Tell me about that.
Yeah, so in our work with the National Institutes of Health, we are working really closely with the National Institutes of Child Health and Human Development. And in 2010, we did a seminar with them, pulling a lot of different researchers and clinical care providers together to understand the need and really push forward the need for a Down syndrome registry. And from that, the National Down Syndrome Consortium was formed. We've been meeting on a quarterly basis since then, and we're really excited to announce with the National Institutes of Child Health and Human Development that that registry will be launched, we expect, in August. So they're in the testing phase of that right now, and they're very excited to get that out there and have people sign up for that.
So sometime this month, as a matter of fact. Will all of that translate then to more money for research, more intensity?
We hope so, and I think that as more researchers have that data available to them, it will be a resource and a tool, and it will allow them to do more in-depth studies.
So, Dr. What fascinates me is the fact that in someone with Down syndrome, this is a congenital situation of what they're born with. But with Alzheimer's patients, it's something they develop later. So these are two different ways of these cells developing?
That's correct. Every person with Down syndrome is essentially conceived with 3 copies of chromosome 21 instead of the usual 2 copies that we all have. And that extra copy gives them more copies of the Alzheimer gene, which is on chromosome 21. So over time, they develop Alzheimer's disease. The interesting thing about typical age-related Alzheimer's disease is they start out at conception with 2 copies of chromosome 21. They grow through their life, and over time, their cells make mistakes, and some of them achieve 3 copies of chromosome 21. So by the time they are diagnosed, 10% of the nerve cells in their brain look like Down syndrome cells because they have 3 copies of this special chromosome.
So that would mean someone with age-related Alzheimer's probably wouldn't develop the features, of course, of a Down syndrome child, but what else does it do to them?
It only gives them Alzheimer's disease as far as we know, but we're looking further into whether it might give them something else which could give us a diagnostic, an early diagnostic, or possibly an insight into other age-related features of their life.
And this is so important because, as we know, there is quite a glut, frankly, of people coming down the pike who are going to get Alzheimer's.
That's correct. Basically, if we all live to be 85, half of us will have Alzheimer's disease, and the other half will be a caregiver. And I'm not sure which one you want to be, but we'd like to prevent both.
Why was the Global Foundation on Down Syndrome formed, and I mean, how does it happen to be in Denver, I guess is what I'm wondering.
Absolutely. So the Global Down Syndrome Foundation was formed in 2009, and it was due to the Michelle C. Whitten, who is our executive director. She has a daughter with Down syndrome, and so she comes out of the cable industry. Her parents, John and Anna C.
Well-known names.
Yeah. So they were able to devote a significant amount of resources towards the research for people with Down syndrome. When Michelle had learned while she was pregnant that she had a child with Down syndrome. And so they did a lot of research into, okay, what's out there, what kind of programs, what kind of research, what kind of scientific possibility is out there. And they learned that there was a very limited amount of things going on in that field. So they really worked hard. They did a $22 million gift to the University of Colorado to start up the Linda Crnic Institute for Down syndrome. And then the foundation was formed to be both a fundraising arm and with the mission of improving the lives of people with Down syndrome through research, medical care, education, and advocacy work. So that was really the heart of what the foundation does and why it was created.
And will it now, or perhaps it has already, is there some portion of the institute or the foundation that is devoted to people with Alzheimer's?
Well, yes, and so we do a lot of different fundraising for the Linda Crnic Institute that supports what's called their Grand Challenge Grant program. And so in 2013, we did our very first round of Grand Challenge grants. It supported 14 researchers, a lot of which have a focus specifically on the connection between Alzheimer's disease and Down syndrome, as well as things like autoimmune and leukemia. And so that was a very exciting first step for us in getting that new science funding going.
Hunt, down the road, would you expect this to lead to, I think you already said that treatment could be affected, but could you totally prevent or cure someone with one or the other?
That would be the long-term hope. But I think that the short-term and more realistic hope is that we would be able to prevent Alzheimer's disease in the typical population and in the people with Down syndrome. But that means we have to know early whether they're developing it. And of course, in people with Down syndrome, we know that they are developing it. And that's an incredible gift to science because we can study them as they age and see Alzheimer's disease developing in real time, as opposed to the typical population where we sort of have to wait for them to have memory problems.
That's right.
But the fact that we can study these diseases, or I shouldn't say diseases, but conditions. Alzheimer's disease is considered a disease, but Down syndrome is just a condition, but it leads to Alzheimer's disease. But the fact that we can study them in one university, in one center, with the same investigators, is unparalleled anywhere in the world.
How did you happen to discover the connection?
I'm a geneticist by training, and when I see two conditions that seem to have a relationship, the simplest question is there the same mechanism? And so we started looking in the microscope at cells from people with Alzheimer's disease, cells with people with Down syndrome, and found that there were some of the same. And that opened up a whole new realm of research.
Just recently, Michelle, the foundation brought together a lot of people who are interested in all of this.
Yeah, absolutely. And so we had our research and medical care roundtable that was at the Children's Hospital of Colorado. There were about 450 people there in attendance, and we had 3 different panels, one on research and medical care, Alzheimer's, and Down syndrome, and basic research that was going on, as well as an update about prenatal testing issues within Down syndrome. And so it was a really, really wonderful day. We were very happy to have people such as Dean Hartley, who's the Director of Science Initiatives at the Alzheimer's Association, the National Alzheimer's Association. And we're actually doing a joint grant program with the National Alzheimer's Association where it's about $1.2 million in grants that will be announced soon, I believe, and we're giving those out in conjunction with them.
And coming back to your research, I know that's going on in several places in the world, emanating from here, isn't that right?
Yes, that's right. As you probably know, scientists love to talk to other scientists, and we do it as often as we can, and that encourages collaboration across institutions and even within institutions, so that without the support and help of the Crnic Institute and the Global Down Syndrome Foundation, this would have been harder, but now it's easier.
Are there people with Down syndrome around the world too? I mean, are there populations that all of these researchers can draw from?
Yes, there are. Obviously, people don't travel as easily as data, so we can share data throughout the world, in Europe, in Asia, and the United States. And what Michelle was talking about, of course, is a Down syndrome registry, which will allow us as scientists to contact people with Down syndrome, and it allows people with Down syndrome to contribute to research.
What would, if I were a parent of a Down syndrome child at this time, what would this mean to me?
Well, it would be very encouraging because there's so much new data that we can put together about both Alzheimer's disease and Down syndrome, and people are getting excited. This new grant program at the Crnic Institute awarded grants to 13 investigators that many times had never really thought about working on Down syndrome before, but now that they see the possibilities are getting on board.
The making Alzheimer's easier to diagnose earlier, as you mentioned, would be so key to everything. How is it that this discovery helps do that?
Well, one of the things that we've understood about Alzheimer's disease is that these cells arise long before there's any clinical manifestation. So that's one diagnostic. The other diagnostic, of course, are the new brain scans that have been developed that allow people to see amyloid in the brain that causes Alzheimer's disease long before any clinical symptoms. And that means that you can use a new drug or treatment and see if it gets rid of that amyloid and if it helps the disease stay dormant instead of coming to the front.
Are the treatments, medications they are using for Alzheimer's currently good? Are they working? Is that moving it along? No?
It is moving it along, and the best we usually say is that it can slow the decline for about a year. But that's why so much effort has been put into finding a new treatment, because the current ones are not attacking the basis of the disease and they're not slowing it enough to be very effective. We need something much better.
Michelle, back to the money involved in this. Why is this kind of research so underfunded when we know that there are so many implications for the future?
Sure. You know, I think it's been a combination of two things. One, the Down syndrome community has traditionally had a lot of different organizations at a national level that weren't necessarily coordinated in the past, but they are today. And we're really, really pleased that the National Down Syndrome Congress and the National Down Syndrome Society are working hand in glove with us, and we're very coordinated in our efforts, and we each have our different strengths and work on different things. And so now we really feel like we're working with one voice, which we weren't before. And I think that the other reason that it traditionally has been underfunded is because there did need to be more and better science focused. There were a lot of researchers who were not focused on Down syndrome in years where there was a cut to the research funding for Down syndrome at a national level. So we're really working to turn that back around and change it, and as Hunt had mentioned, get a lot more and better scientists in the field that traditionally have not worked on Down syndrome before.
So these are colleagues of yours?
They are, and that's something that we're hoping to expand, because the more people working on Alzheimer's disease and Down syndrome or Down syndrome alone, the more they can talk to each other and came up with new ideas that they might not have come up with before.
Well, this is very, very good news. I'm glad that Colorado is in the cutting edge of all of this. And I thank you very much, Dr. Huntington Potter and Michelle Livingston. Fascinating developments here, and we thank you for the insight tonight. That is Colorado State of Mind for this weekend. You may see this program again or any of our programs at video.rmpbs.org. And please join us again next Friday. Thank you for tuning in for this Friday. I'm Cynthia Hessin. Good night. It's really kind of a growth industry at the moment.
It has to be. The problem is intractable without research. And the advantage of working together Alzheimer's researchers and Down syndrome researchers is that we will benefit each other scientifically, and we will also benefit each other politically, because without the political will, there will not be extra research.